Welcome back to Rural Health News. For the next few episodes, we'll be hearing from a variety of guests that will be featured in our upcoming Summit series, which you'll hear more about soon. For each of these guests, we ask them what is most urgent news headline in rural health today. Angie, what is the most urgent piece of healthcare news you're personally watching right now? What are you keeping your eye on?
Medicaid cuts.
Medicaid cuts.
It's huge for us.
Yeah.
It's a huge part of our patient population. It will have a huge impact on how we operate our organization and the services that we can continue to offer. So for us, it's the Medicaid cuts, educating our board, educating our employees, and educating our communities, and encouraging them to reach out to our representatives to let them know.
What frustrates you most about the argument on the other side? I mean, for me, it's the fraud, waste, abuse. We're not fraud, waste, or abuse. But, what really pains you about the conversation on the other side?
I think that's a lot of it. I understand that it's out there, but our small hospitals are some of the most efficiently ran organizations, and the people that work in them wear so many hats.
They do.
And they're so talented. And these communities, if that's their local hospital, I think them being the ones punished for some of that is really frustrating.
It's very bad, very bad. So, Bill, what is, in your opinion, the most unique piece of healthcare news you're watching right now?
Yeah, I'm really watching what happens with 340B. I think many people misunderstand the program.
Agree.
And when you look at the essence of the program, ensuring that people have access to pharmaceuticals that they need for their health.
Absolutely.
Right? And when you look at the operating margins of hospitals and health systems, single digits in the state of Michigan, most are negative.
Yeah.
When you look at the operating margins of pharmaceutical organizations, double digits.
Double digit.
JJ, it really does boil down to this conversation around the future of the Medicaid program is mission critical for our organizations, large and small, urban and rural. And until that gets resolved in one way or another, all of those other priorities on our list, and it's a long list, JJ, as you know, those all, unfortunately, have to take a back seat because this is an all-hands-on-deck affair at the moment. Not just with our association, but with our partners in Lansing, with our partner state hospital associations around the country, and certainly with the American Hospital Association. Rick Pollack and his team doing a phenomenal job leading in a very, very challenging environment. But, that is where our focus has to be.
It does.
And I'm encouraged by at least what we're now starting to see in terms of public response as more information is understood by the voting public. Their concern level is on the rise.
It is.
I think that will hopefully put some sand in the gears of this runaway train in Washington. I hope our elected officials will take heed and understand you need to think twice before you do damage to a program that's created access to millions of Americans.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.